Warning signs of stroke. 1 month ago, a stroke occurs when the blood supply to the brain is interrupted. In about 80% of cases, it is caused by a blood clot or a blocked artery. A stroke can also occur if the blood vessels themselves are damaged. Without a good blood supply, brain cells don't get the oxygen they need to function. If the power is cut off for too long, the brain cells die. Hey, if you are still connected with me, so please subscribe my channel. Let's talk about some warning signs of stroke. Blood pressure. According to Stroke UK, high blood pressure is the biggest risk factor, accounting for almost half of all strokes. Peter Rothwell, professor of neurology and director of stroke prevention research at the University of Oxford, explains that ischemic strokes accounting for around 87% of all strokes are caused by narrowing of the arteries in the neck and brain. It is associated with high blood pressure. Hypertension also affects the heart and causes atrial fibrillation, which can lead to blood clots in the heart and can be a very strong trigger for stroke, he added. The best way to check for atrial fibrillation is to check your heart rate. It is normal to have an irregular heart rhythm occasionally, but tell your doctor if your heart rhythm is consistently irregular. Blood pressure can be measured at a pharmacy or directly using a blood pressure cuff. You consistently get a value above 140/90. It is important to tell your doctor. For many people, simple lifestyle changes and sometimes just medication can lower the readings. TIAs or mini strokes. Sometimes people who have had a stroke experience a series of transient ischemic attacks TIAs that cause warning signs similar to a stroke. Neurological symptoms start suddenly and involve the formation of small blood clots that block blood vessels. Instead of itchy arms lasting for hours, it comes on suddenly, says Professor Rothwell. The symptoms are very similar to those of a stroke. You may have numbness in one leg, weakness on one side of your face, difficulty speaking, or loss of vision in one eye. After a TIA, the blood clot either dissolves on its own or the brain adapts to avoid damage from the blockage. However, a TIA puts you at risk of a more serious stroke in the days to come, so it's important to seek medical attention if this happens. Blood thinners such as aspirin can help prevent or reduce blood clots. If you're not sure if you've had a TIA, see Prof. Rothwell recommends taking aspirin anyway. If it's not TIA, nothing is lost. If so, it could have a significant impact on stroke risk, he said. High cholesterol. High cholesterol levels put you at greater risk of heart attack and stroke. This is because fat builds up in blood vessels, making it difficult for blood to flow through them and causing them to break and form dangerous blood clots. If you have a family history of heart disease or stroke, you may want to have a blood test to check for high cholesterol. However, lifestyle factors such as poor diet, obesity, and lack of exercise can also increase the risk of developing bad cholesterol. Family history of strokes. You can take preventative measures to reduce your risk of stroke, but family history also plays a role. A 2003 study from St. George's Hospital Medical School in London found that stroke patients under the age of 65 were almost 3 times more likely than non-stroke patients to have a parent or sibling who had previously had a stroke or heart attack. Family history is a risk factor for stroke at an early age. If you have a sibling or a parent who has had a stroke, especially if you had a stroke at a young age, your risk may be double the average, says Professor Rothwell. The risk of stroke generally increases with age, doubling every 10 years after age 55. Lifestyle and daily routine. Unhealthy lifestyle habits such as smoking, excessive alcohol consumption, diets high in salt and fat, and lack of exercise can lead to stroke later in life. According to the Stroke Association, smoking doubles your chances of dying from a stroke. If you smoke 20 cigarettes a day, you are 6 times more likely to have a stroke than a non-smoker. In addition, poor eating habits can increase blood pressure and cholesterol levels. A study published in the Journal of Neurology found that the average age of people suffering a stroke fell from 71 in April 1993 to 69 in 2005. Researchers believe this drop is due to poor nutrition. For your health, the NHS recommends a low-fat, high-fiber diet that includes fresh fruit, vegetables, and whole grains. Numbness. You may suddenly feel numbness in your face, or loss of feeling in your arms, legs, hands, feet, or other extremities. It can feel like a tingling sensation. Additionally, during a stroke, numbness may occur on one side of the body while the other side remains fully functional. If you feel numb, you can repeatedly touch, rub, or shake the numb area. Difficulty understanding. Like confusion, it is difficult for a person to understand speech, language, or numbers. If you see someone having trouble understanding what you're saying, you might notice them frowning, shaking their heads, saying no, talking less, and feeling insecure. Severe headache. You may have a sudden, severe headache in your head, scalp, or neck. It usually occurs in people with no known cause and no personal history of headaches. When headaches get worse, you often hold your head or rub your temples, and you may also be sensitive to light. Loss of balance. A person may have difficulty standing, walking, or moving. If you notice that someone has lost their balance and coordination, they may seem to fall out of nowhere or suddenly appear very clumsy. A person can stand or rock back and forth to grasp a stationary object. If you found this video helpful, so please subscribe my channel and hit the bell icon.